Okay, we are ready.
All right, welcome to the December 11, 2025 meeting of the Health and Environment Committee. My name is Rupal Picard and I'm the chair of the committee. Tonight, we are joined by Assistant District Manager Brendan Berth. This meeting is called to order at 6:32 p.m. As a reminder, New York State law requires all committee members who are not able to attend the meeting in person to have their cameras on and their first and last names displayed from the time the meeting is called to order until the time the meeting is adjourned. Members of the public who are attending virtually, you can raise any questions or comments that you have through the Q&A feature of Zoom. Members of the public who are here in person, you can raise any questions that you have by raising your hand. If there is time following the committee's discussion, we will field questions from the public. So we don't have anyone taking the minutes. Let's see, anyone else on there besides Elvie? If not, oh, you already, all right, Brock, thank you. You had taken it, so I wasn't expecting you to volunteer again, so thank you. Yeah, Brock will be taking the minutes for tonight's meeting. We will now take attendance by roll call. Brendan will conduct the roll call.
Committee members, I will call your name. Your name is called, please say present. I will announce if there is quorum. Marty Barrett.
Present.
Elvie Barroso.
Present.
Liz Burr, I don't see yet. Brock Friedman.
Present.
Gloria Haig won't be with us tonight. Rupal Kakad.
Present.
Kevin O'Keefe.
Present.
Mubin Siddiqui.
Present.
And Kat Valero.
Present.
We have a quorum.
All right, the agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, please raise your hand. Seeing no objections, the agenda for tonight's meeting is adopted. The minutes from the November 13th meeting were distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, please raise your hand. Seeing no objections, the minutes from the November 13th meeting are adopted. They will soon be available on the CB6 website. All right, in order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. Committee members who are here in person, if you have a question about committee business or wish to make a motion, please raise your hand and I will identify you so you can speak. Committee members unable to attend in person, if you have a question about committee business, you may raise your hand through Zoom and I will identify you so you can speak. All committee members, it is extremely important that only one person speak at a time so that members of the public watching at home can understand what is being said by each committee member. The chat function for the committee members present via Zoom should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information like an email address that was already stated aloud on the record during the meeting. So tonight's agenda, we have a presentation from the Bellevue CAB, the Community Advisory Committee, on the request for support of their 2026 budget proposals. So we have Karen Moore, who is the chair of Bellevue CAB, and Ryan Fodero, the legislative committee of the CAB. So I'll hand it over to them.
6:40. Either I'll start talking or.
So do we have the presentation, that we can?
Slides, no.
Okay, so if you want to start on it, do you want to come over here so they can hear you, because that's where people, yeah.
So our plan was for me to spend 3 or 4 minutes on Medicaid and the changes to Medicaid. And then Kevin would just give an impassioned statement of supporting Bellevue. So in 2023, the federal government spent $890 billion on Medicaid. It's the largest health insurance plan in the country. I think the fact that they spent $890 billion speaks to the need. HR 1, the one big beautiful bill, is going to cut about $1 trillion over the next 10 years from Medicaid. And an editorial comment is, since the federal government never gives poor people enough to actually do well, it's really going to impact people severely. So the cuts to Medicaid include, first, their expiration of the ACA subsidy. That's not strictly Medicaid, but that's been in Congress and the Senate just said, no, they're not going to okay.
Senate voted something today
Said,
approving for the current, for the following year.
oh, I thought they said, no, they won't okay it. So that's great news. I just looked at a
That was
headline.
today.
Good. There's gonna be reduced federal share of payment, and that started in July. It also happened in September, and then they're going to cut more in January 2026, which is around the corner. There are new community engagement requirements. Come on over, Ryan. Community engagement means work or volunteer or go to school for 80 hours a month. That's really half-time. Exemptions for people with kids under 14, but everyone else, if you want Medicaid, you have to show you deserve it. You have to recertify every 6 months instead of a year, and that's really perceived as the most effective way to get people off Medicaid because the paperwork is onerous, and when you're in a bind in your hole, it's hard to take care of those kinds of details. And the thing that is actually helping many safety net hospitals, safety net being a hospital that takes, in which more than 35% of their population is on Medicaid or charity care, is by supplemental insurance. And those are ways to actually supplement the minimal payments you get from Medicaid. They're gonna reduce them as well. So the impact on H&H, it's an impact system-wide, it's actually an impact on everyone who uses Medicaid. There's gonna be a significant increase in unreimbursed care. So they think about 950,000 people in New York City will be affected. 1.4 or 1.5 in the whole state. A significant number of those people live here in New York City. And that's going to severely impact all the H&H system hospitals. And they anticipate that statewide with these $1 trillion cut, which hasn't happened yet, and we'll see what happens in the midterms, et cetera, they're gonna lose about 78,000 healthcare jobs and 136,000 jobs in related activities. So it's designed to have a profound impact. You can see that if it costs $890 billion a year, that was in 2023. They may think that it's almost $1 trillion anyway. What's $1 trillion, cutting $1 trillion over 10 years? What's the big deal? But in fact, it's really impacting the people who have the least amount of resources to be able to handle it. And by the way, the H.H. Health and Hospitals position on this is that we will survive, we'll keep going. They're hiring more financial counselors so that people who lose Medicaid or people who lose the essential plan, which are immigrants, they're trying to get them other forms of health insurance. All right, so that's the background for our more complicated and more detailed request for support this year. And Ryan,
I retract that. It was two bills that both failed. Sorry about that.
oh, what else failed?
There was two ACA
Oh, and they
related
both
bills.
Oh, yeah, both to extend the subsidies, right? And they failed, yeah. So there we go. That's the Medicaid.
Very, very sad.
Yeah,
At least we have hospitals and doctors here, though, to begin with. There are medical deserts across the country.
Oh, yeah.
That clinics and hospitals and nurses who are hired and doctors who are hired that won't get paid.
Mhm.
so there's actually a lot of federal programs for rural health because of that very reason. They're gone.
Mhm.
Incredible.
So,
So, Ryan?
Yes,
Ryan
Ryan Federo.
Federo,
For the-
nice to
for the
meet you.
Building Cab as well. Nice to meet you all.
So Karen said after she gets done,
I was gonna turn it over to you.
he's gonna turn it over to you.
So
I'm
I
assuming
apo-
you're done.
Yeah.
All right.
I apologize for being late, so Karen, stop me if I'm
No.
repeating anything you'd already said.
You, if they hear it twice, it's great. They'll remember.
So essentially, to kind of set the stage, Bellevue is the tertiary care center for all of Health and Hospitals. So if you think about like Weill Cornell, it's sort of this Upper East Side premier healthcare center, it's level 1 trauma center, it's where people go on the worst days of their lives. And Bellevue does pretty much all they do. Everything from delivering babies to trauma and gunshot wounds where the NYPD and FDNY take their officers and firefighters, right up to then like ECMO, which Bellevue has, which is essentially a heart-lung machine that does the work of your heart and does the work of your lungs for people who are very, very, very sick. That's something that's generally only done in super high-resourced, well-resourced hospitals. And
That's
Bellevue is
amazing.
the premier center in New York City for that. And we do it all on a public budget with about 60% of our patients being covered by Medicaid, as opposed to proportions usually under 30% for other private hospitals around the city.
24, 28.
Yeah. And Medicaid only reimburses about 70 cents on the dollar. So for 60% of the patients that come to Bellevue, Bellevue is getting paid 70 cents for every dollar of care they give that patient. And that's obviously unsustainable. It's a pretty substantial deficit. And other hospitals who have, 24, 28% of their patients on Medicaid have commercial insurers, your Cignas, your United Healthcares, your Aetnas, making up that gap. So they might reimburse $1.30 for care provided to close that gap. Bellevue doesn't have that luxury because more than half of our patients are on Medicaid, and we have this gap. And we rely on state and federal funding to close that gap. So there are a number of mechanisms. One is disproportionate share DSH hospital payments, which essentially is whatever that gap is, the government contributes kind of that difference. And
If a disproportionate share of your population needs
right, so
Medicaid.
that's that safety net threshold at 35%.
And that comes from the state?
Combination of state and federal, but the state generally is kind of allocating that
Implementing.
thing, yeah.
Medicaid's a federal program and they pay for like 70% and states pay for 30%. And then there's a lot of mechanisms to make it work. And every state there are minimum requirements, so to speak, and every state can add on what they think people need. And New York State is the most, I don't want to say generous, adds on the most for people to their basic level of care is higher than it is in other states where there's less of, I don't want to say a social conscience, but less of an less of a desire to do that also.
And so, thank you. And another mechanism that governments have to kind of help close this gap is called the upper payment limit. So that's our first ask is the fee for service upper payment limit. And it essentially helps all insurers have a maximum that they'll pay for a certain type of care. So everything is coded when a doctor performs a service. It's given a number code and that goes to an insurance and that's associated with a certain dollar value. And so for say a CBC, a blood test, making numbers up here, it might cost the hospital $5. Cigna might reimburse $5.30, but Medicare and then Medicaid especially will reimburse, $3 of that. And that's sort of the maximum, the upper payment limit. And what we're hoping will happen is that that limit actually gets increased to cover a larger percentage of the care that's provided. So that 70 cents on the dollar might end up being 75 cents or 80 cents on the dollar for every kind of test done.
And it's known that there is Medicare for 65 plus and disabled, and then there's Medicaid. And so the upper payment limit for UPL for Medicaid says, okay, a supplemental payment will pay you as much as Medicare pays because there's just Medicare pays better.
Mhm.
And
The
it's the
reimbursement
reference.
rate is better,
It's the
right?
reference for all
Right.
payers.
So if you can, since Medicare pays better, if you have, and you're getting this much, if you can get an upper payment level, that means you'll get reimbursed at Medicare rates instead of Medicaid rates, and leaves you much better off.
And does Medicare rate cover like the cost, or is it still 70% of the cost? Like, where's
No, so
Medicare payment?
Medicare
rate?
is generally, it's the reference for all reimbursed care. And every provision of care is going to cost a different amount depending on kind of the hospital and the clinic, and because hospitals have different cost structures, and sort of the difference is in insurance, it's cost and charges. So charges is actually sort of those eye-popping numbers you probably see when you open up your medical bill and you see $100,000 for one night in the hospital. It doesn't cost the hospital that much, but they know insurers are only gonna pay, you know, whatever the charge
2,000.
is, right?
Mhm.
So they charge a huge number to the commercial insurers, but if they're charging not Bellevue, if they're charging Medicare, they can charge the Medicare rate. And that's what Medicare will then reimburse. So hospitals have this goal to make sure that their cost of service is going to be reimbursed by Medicare, because really there won't be much higher, and then Medicaid will reimburse lower than the
But
sort
just
of
to kind
Medicare
of
base.
Reinforce the question, I still thought that, yes, it does pay more than Medicaid, but I still thought it was less than 100% of payments.
So
So
let's
for
say-
instance,
It generally
Yes,
is.
but that's a
Okay.
big secret.
So,
Yeah.
to go back to the example you said, the blood work says, it costs $5, right? Will Medicare pay $5? Will Medicare pay $4, $5.30? Like, just if it costs that much, just is
It's-
it above at?
Generally
level?
below, but close to.
Okay.
They'll never pay above probably what it costs, but it's generally below, but close to that $5. So hospitals don't lose a ton of money on
Okay.
Medicare, but they're not making money on
Okay.
Medicare.
Well, nothing we would write up, CMS would even look at.
Mm.
You know, there's nothing that we could do in regards to CMS, but the mayor-elect, I'm sure as he was going along, he must have looked at this and said something. What has he been proposing or felt? Nothing?
Hasn't said
No.
anything about health, because that's sort of what I
Really?
pay attention to.
Mm,
I haven't
Wow.
heard them down to say anything,
mm.
so he'll get a big shock. I don't mean shock, I'm sorry, so I'm sure he's gonna have quite an education,
Mm.
when he gets
Oh.
started. But he hasn't really commented publicly,
Cause it's only through the city that community boards could do something.
right?
Mhm.
But you see, for Bellevue, like, I think the state pays for the shortfall for supplemental insurance so that the hospital can survive.
Mm.
The state pays, I think, 23%, please don't hold me to the numbers,
Mhm.
and then the city pays 15, or that's reversed.
Mhm.
So the reason why Ryan drafted a resolution that said state and city was because, yes, there's state reimbursement, and then there's what the city, as a city agency pays. So, we're looking for support from both.
Oh,
And there's also, go ahead.
Oh, sorry for such a mundane question, but do you mind both spelling your names for the record?
Sure. Okay, Karen.
Moore.
Okay, thank you.
And then Ryan, Ryan, Federo, Fodero.
And he used to work for a consultancy where they did this kind of stuff, and now he's applying to medical school.
I work at Memorial Sloan Kettering now, and just as like kind of a base for everything, MSK just had to lay off about 2% of staff because in preparation for these cuts. And luckily MSK can afford 2% of staff. Bellevue is operating at the barest of minimums, so there's no such thing as a 2% cost cutting layoff.
Yeah.
So back to kind of also what the city can do, because H&H is one of the largest public hospital systems in the country as well. The largest, the city garnering its support for H&H kind of holds some political weight in Albany and then in DC as well, just as sort of like a bellwether for public hospitals and public healthcare in the country. So it is important to have sort of more local support that then does actually kind of bleed out to bigger, kind of bigger fish.
it's a very bleak picture ahead of us.
Well, last year we backed the residents and the doctors
Mhm.
as far as their increases.
Yeah.
Thank
Which,
you.
yeah, certainly didn't want to lose more of them.
Yeah,
Right.
that's for sure.
So they came to us and we said, we can't do labor, we can't get involved in labor, go see the community board.
That worked out.
Alright, and so the second kind of point on our second ask on the resolution is for telehealth parity. So how many of you have had a telehealth appointment with a doctor? I'm sure most, it's pretty easy, you log on, at this point, it's usually like the Epic portal, and it's essentially a FaceTime call with your doctor. And I don't know where your doctor might be, but it could look like they're at home or et cetera. Under the new bill, there's a kind of goal to cut reimbursement for telehealth. So not eliminate reimbursement for telehealth, but reduce the current reimbursement rate. And that's because if you go to a doctor physically, you have a clinic space costs money, you have a receptionist, you have a medical assistant to check you in, there's medical equipment. It's kind of expensive to run a clinic, so insurers, public insurers and private see that, you know, we should pay for all the supplies, everything from, you know, a thermometer to like the electricity cost of the lights. They think now that because telehealth is kind of growing,
Easy.
it's easy. It doesn't necessarily require all the wraparound clinic space, that it should be reimbursed less. However, in my day-to-day now, I work for a liver surgeon who does telehealth visits. He does the telehealth visits from the office because he'll have one telehealth visit and then he'll go see a patient in the office, then maybe another telehealth visit. And it's actually allowed him to double his productivity because he doesn't need the clinic space to see those patients, but he still has to maintain a clinic space. He still has to be able to bring those patients in if the telehealth turns out that they're sicker than they might have expected. And it's kind of a big kind of pain point for not just the hospitals, but the patients at the end, is if telehealth is reimbursed for less, might not make up the gap of kind of physicians using it. So then they're just not gonna do it. Hospitals are gonna say, no more telehealth, we're done with it, and that severely reduces access for, especially for Bellevue patients who might be coming from outer boroughs and might have trouble with transportation.
Or with mobility issues.
Mobility, so it's important that they're able to see their doctor and have, you know, a medication adjusted, and they can have blood work done locally and have the doctor see it during that visit and go over it. And losing telehealth, you know, reducing reimbursement isn't just people going to hospitals going to get paid less for the telehealth. It's people who are just not going to have access to it anymore. So that's our second ask.
Bellevue said that we had a presentation that their no-show rate for psychiatry and addiction services was roughly 86% or something. And with telehealth, it's 23%. Which just means that instead of coming to see your therapist or your psychiatrist or your social worker or whatever, to have to get out of bed, to get up, to get cold, to find someone for the kids, to wait for a Access-a-Ride and lose your appointment time, all of that stuff disappears, and you just, in addition, telehealth, for people who aren't signed up on a sort of an added twist, is for people who have not signed up for Epic for medical records because they're afraid of their privacy concerns or whatever. They have telephone calls with their doctor. So it's really therapy sessions by phone. And they're trying to see that those cases are also reimbursed at the parity levels. So it's much more complicated than it looks like. But if the physician can be twice as productive, means the hospital can do twice as much and get more revenue.
And also the improved no-show rates, that directly saves the health system money, and not just the health system, especially for the psychiatric services. It saves the health system, it saves the NYPD, it saves FDNY EMS a lot of money because people are keeping up with their care
Regimen, yeah.
at, you know, 4 times more than they
And
would.
then they're also able to like join the community and get
Exactly.
jobs and, you know, then take care of them. Yeah,
Right,
like
so
overall,
the
it's
access
just
itself is
huge.
extremely productive.
Yeah.
To that end, I'm kind of embodying Gloria right now. Is there,
Oh, yeah.
I did read your resolution. And I will save more questions for later, but since we're on the topic of telehealth and access being the bigger, and being kind of a domino effect of other systems that would support healthcare at large. I'm just curious, like, what is the data you have on the telehealth mechanism as like to defend the case of like when it didn't exist? I'm thinking even within the last 5 years, post-pandemic specifically, that's when I feel like telehealth kind of was in booming range, particularly at the epicenter of the pandemic, which was New York. So I'm just curious if that's something that you could reference to make a stronger case, because I feel like when officials are looking at resolutions like ours, like the more stronger backings that we have as reference points can really help.
So I don't know if it's not data. This law is every 3 years, that we're asking for it to be final, because I think it started in 2020 with the pandemic. And the reason why it was only 3 years was because they didn't know whether or not it was a flash in the pan, or was it just because of the pandemic and are physicians lazy? You know, there's 100 different reasons why people wouldn't want telehealth. So what we've heard 3 or 4 times is that it allows physicians to be more productive. I guess you're number 5. You know, that it allows, based on your experience, allows physicians to be more productive, but we can definitely ask public affairs if there are more data, or of course, I can do a search and reference the result.
Or even the amount of, the patients that have used it. I mean, I think if there's an increase, we definitely would want to put that in.
Okay,
To say, more people are using this service.
yeah,
It's
so now
critical
they've
for-
realized it's permanent.
Yeah.
I'm sorry that it's, yeah.
Yes.
And
The state started coverage of telehealth and Medicaid around 2000. It did take another 10, 15 years for the feds to put their piece into it. And now they want to cut it.
along with other resources. Yeah,
Oh, billionaires have to get their
yeah.
trillion, no, it's $1 billion tax cut over 10 years.
That's very helpful to know. We need more data.
Yeah.
I don't want to go there.
And just a note,
Yeah, I think it's a great idea.
if you
And
can.
there will be like academic research,
There is,
since we're still only kind of at the 5-year mark, there's even more just that can show like the economic productivity and stuff, but I think there's still. That's sort of just budding out, but and it won't be specific here, but it
so,
will exist.
so would it slow things up if we did a search and, a literature search to find, because having information from public affairs saying, gosh, doctors are more productive. Or maybe they could say, I'm not sure Bellevue has collated that info, so it might have to be sort of
They would have data on the users.
Oh, that's what
and
I'm saying.
Yeah.
They,
Maybe
and
not
then the
how
no-show
we
rate
use
data.
But I
Right.
think that still lends
Right.
the case that
Right,
more
okay.
people are
That's a great
actually
idea.
utilizing this
Right.
service.
Yeah.
It is
I-
now critical
Okay.
to people who were already ostracized when it wasn't available.
Okay.
Yeah, of
That's
the,
great.
what's the number of outpatient
Who
visits we have?
requests the independent budget office
Yeah, I
to
looked,
do a report?
did you see the
The-
report on
The
health?
independent budget
The
office,
outpatient,
that's their function to find data for the city.
So they did a report, by the way, on, oh, I didn't bring it, they did a report on the effect of the one big beautiful bill on health and hospitals.
I missed it.
I know.
I'm on their mailing list. And so, look at them.
Might even be coming from a fundraiser, it might even be in an impact report or an annual report that you have. There might be some-
I skimmed theirs, I haven't seen it, but I'll ask tomorrow and ask them to make it a high
Always a
priority.
shot. You
Yeah,
might,
It's
you
a
might- you
great
might be
idea,
surprised.
thank you, it's a great idea. It's a
So,
great idea, and if it helps, well,
Yeah,
of course, it's worth that effort.
so,
So,
was there anything else?
Just the third ask is kind of summarizing pretty much everything we've talked about already, and it's to help bring Medicaid reimbursement fully to parity. Which is, we think that the best way to reduce the health disparities, it's the best way to improve quality of care, it's the best way to improve access to care. By having kind of these public hospitals at fully funded levels because they're doing what they are, completely bootstrapped, the bare minimum funding they could ever possibly need. And imagine what they did if they were fully funded and got reimbursed for the costs they had. They'll be the best hospital in the world. So,
We know that's not gonna happen
yeah,
because.
But we gotta
it's
ask for it.
tremendous cost, But if you keep asking, we're just trying to, you know, I don't mean chip away, but. add on.
remind them.
Yeah, but the wording is increase reimbursement rates for safety net hospitals.
Mhm.
Because if you're in a hospital with a higher cost structure and 25% of your patients are on Medicaid, well, you get more money. Your supplemental, well, you end up. Columbia Presbyterian gets hundreds of millions of dollars
Mm.
in Medicare reimbursement. And it's because their cost structure is higher. So we're trying to just say increase the reimbursement rates for safety net hospitals.
Mm.
And that's sort of to temper the fact that the country, if you keep subsidizing.
Have you
physicians'
approached Dan
salaries-
Goldman's office
No, not
or
yet.
Nadler's office?
Yeah, I figured, well, Nadler,
Yeah, I know, but nonetheless,
Yeah.
he's still there.
okay.
And, you know, whatever's in his office will be passed on to
To-
whoever's
yeah.
takes it over.
Yeah.
Mm.
No, Dan Goldman I hadn't done because I called and asked about, I called his office twice. About 3 months after he got on board. Hey, can you turn that off?
Turn what off?
Ooh, wait, this is a public meeting,
Oh,
so
okay.
they can't,
And
yeah.
I asked first. What's the one state payer system? Can you give me any information on that? And, they said, we'll get back to you. So I waited 6 weeks and called again and they said, we'll get back to you. So I guess I thought he was having, you know, come up to speed situation where he didn't have whoever was supposed to answer the phone to tell people to relay the message or something.
Mm.
Had that experience with other of our local electeds.
Yeah, yeah, I don't mean to point the
Yeah, I
finger
know
at
that, yeah.
him, but you said him and I.
Yeah,
After he replaced, anyway, it doesn't matter.
yeah.
So one of the email you sent also mentioned something about restore capital funding cuts.
That's last year.
Ah, okay. All right.
Oh, I must have sent you last year's. rather.
Oh, okay.
Yeah,
Can you just pull up that reso just real quick, the one I sent you,
Is it this one? Or
go to the end, cause, oh, yeah, this is the end,
I think that's last year.
yeah, this is the one. Yeah. Can you go all the way up to the top? Yeah, so, this is.
this last year's,
Oh, no, we had another,
that's last year's result.
we have
Yeah.
another link. There was another. email
Yeah.
With a link in it.
Yeah, so
yeah,
there
this is one I had up before the meeting. Should I
yeah,
go to that?
Yeah, it's right there, 12/7.
Yeah,
No,
12/7.
no, lower. No, you just said it. In your history, it's probably the
History.
5th one down, draft. Yep, there you go. I think that's one. Yep,
Yes.
Yes,
that's it.
I'm looking at it right now. That's how I know.
So there are 1 or 2 minor changes. May I specify them?
go ahead, which changes?
First page,
Okay,
the American, the Health Association. The update for whereas, the third whereas.
Okay, there is.
1, 2, 3, there we go.
Provided care to delete 667 100,000 and make it 520 100,000.
Okay,
Because Bellevue's numbers, there's 2 different numbers and I'm taking the Bellevue numbers.
Okay,
The hospital association, delete 30,000 inpatients, they find that confusing. She said, don't even get into it. I apologize. Okay, that's it for page 1.
You relieved all the problem of the hospital already.
It should always be this easy. And so we edit something and we just want to know whether or not you want it. So Whereas the Bellevue respectfully requests, third line down reflects the actual cost of service.
Where is this again?
Where is the,
Third
that,
line down,
that one that you're looking at,
sorry,
third
yeah.
line in
Yeah,
that
the
one?
third line there.
Yeah,
Okay,
cost of service and utilization.
I'll put in caps lock for now. Just so
Yeah,
that we
be
can
made-
figure out whether we want it or not.
Yeah, so what I add, and I don't know if it's relevant, instead of expiring on March 31st, 2026, do you care about that?
what was that again?
The 1 and 2 are both expiring on March
Oh, okay.
31st with the new fiscal year.
Okay.
So is that relevant? It might not be relevant.
Yeah, because then that would mean we would need to pass this before that expires. So we wanna get this,
Oh, okay,
yeah.
so, well, why don't I give it to him?
Okay.
Here.
Yeah,
So, or you can read it.
so,
It's the yellow highlighted.
so it says, be made permanent and then, be made permanent instead of expiring in March 31.
2026.
Yeah, and add space. Instead of expiring,
All caps.
Oh, comment, instead of it's expiring.
yeah. In March 31, 2026. Yeah, and
Comma.
then
Oh, it's there, good. You can take out
Utilization.
utilization.
Not
actualization, we're all looking for in the health system, but we should probably say utilization.
And utilization.
So the actual cost of service and utilization be made permanent,
Mm-hmm,
instead of expiring on March 31st, 2026.
correct. And then we're gonna add the same thing after the second one, the telehealth parity law, which enables vulnerable patients to receive telehealth services be made permanent instead of expiring on March 31, 2026.
And then I added, but I don't know if it matters. A footnote that says, well, you can read it,
Okay.
and then tell the group if you think it's needed.
The footnote says the upper payment limit is a supplemental payment that is intended to cover the difference between the Medicaid, FFS payment and what Medicare would have paid for the same service.
These are whereases.
That would be a
These are-
whereas.
These are whereases, not, they're
Yeah.
rather resolutions
Yeah.
rather than whereas. Whereases are statement of fact, but before what we then want.
Mm-hmm.
Now, do you need that clarification, or is it okay as is? That was gonna be a footnote, Marty, for upper payment limit. So,
But Marty, are you questioning whether we should
Yeah,
even
yeah,
have the whereas? That's what he's asking.
What these are there, these are in a whereas, it's not, as it's a statement of fact, but it
Okay.
isn't, this is our request.
This is a resolve, what
Yeah,
you're
this is
saying.
the
Okay, this is a resolve. Okay.
Yeah, I
You can-
think Marty is right.
Okay, so we can move this as a resolve then.
So.
Yeah, maybe,
lower.
There is be it further resolved, or therefore be it further resolved.
This is the main.
no, I think this is actually the main
Okay.
resolve,
Yeah.
because
This is what we really want.
Yeah.
You can have all the individual pieces without saying that it'll, we
Mm.
want it to go as a whereas.
Mm.
That all these, these things are, minimal or whatever, and.
And then get rid of the Bellevue Advisory
Yeah.
cab respectfully requests
Seems
part.
good.
or maybe that Manhattan Community Board 6 supports. the
Yeah,
Bellevue.
supports, yeah,
Because we're supporting the
yeah,
Bellevue Cab Service.
yeah,
You have to
support.
fix the English, I think.
Hold up, you already have it. Look right above, the whereas above, you don't have to keep typing. They already have it. Look in the therefore.
Yeah,
It was the one that we
I
had
did sort of
before.
copy and.
Yeah.
No. It was, okay, I'll read it. It was at the original draft. It said the community board 6 will prepare a letter of support.
Or be resolved and then I can press it.
Mm-mm. It's right below. Right there. You can add that to the beginning of the therefore it be resolved in the one that we're working on right now. So the language is already there, is what I'm saying. You can use community board 6 is asking
Committee
for
Board
support.
6 supports.
That's something.
So how would this be exactly? I'm a little bit confused.
Where was the other one that I saw?
Okay, sorry for confusing you.
All good,
Go
all
to
good.
the
Probably
therefore
maybe.
it be resolved
We don't
that
have enough time, so we don't.
Yeah,
Community Board 6 supports the following.
But community board 6.
And then I would use bullets for 1, 2, and 3. I don't think you need it as a paragraph. I think it would be easier.
Yeah, I
Mm.
agree.
Plus, if it's going to elected officials, they are gonna blaze over it.
Yeah.
So you want
Or
it to be
you
as
want it
easy and
simple.
simple as possible. And a lot of our resolutions are heavy in the text, so. You don't want them to miss it.
There we go.
Sorry, Brandon.
All good, all good. This is why it's important to edit live, so that way we can all make sure to be on the same page.
That includes, it's only, right? That includes, the fee for service, upper payment limit, the telehealth.
Yes.
parity, And then the overarching umbrella ask of reimbursement.
Also gonna take this.
yeah,
piece
that,
out.
that can be taken out.
And not mean to be nitpicky, but we want to say, therefore be it resolved that Manhattan Community Board 6 supports the following request from the Bellevue
So
Hospital.
was Tara,
Community
that our
Advisory
community
Board.
board.
Yeah.
Ryan, is it the telehealth parity law? Yeah, that's what it said, or telehealth parity. Okay, telehealth parity.
Oh, I.
Don't know if it's the request of the board. I think it's a request of officials
Well,
of state and city elected officials, at least in the original. That's what you were asking.
It's from
You want
H&H
them to
officials,
support
right?
Financial.
is this the ask from the board cab or the
H&H.
H&H? Okay, so then we can, okay,
Problem.
so then we can take a, yeah,
So from New York City Health and Hospitals.
Yeah.
Yes.
okay.
Got it. There you go.
Health plus sign, they're very particular. Hospitals
Yeah.
operation,
Got it.
hospitals is enough. But is it the following requests
Supports the following requests from,
in fee
Yeah.
for service, upper payment, the telehealth parity law, and they support. So we have to, it supports Medicare reimbursement rate increases. But how do we make that, it's not parallel, you know how it's. Right,
but then we have another increase right there on the second line. It says Medicaid reimbursement rate increases for safety net providers be increased.
Yeah.
Like,
increases for safety net, no, keep that there, please. Because it's cleaner, editorial, Medicare reimbursement rate increases. As for safety net providers, as increasing Medicaid reimbursement. rate.
okay, so
Like
take
every other
that,
second,
that
yeah.
second increased out then.
Right, so take
Okay.
B increased out.
Yeah,
Yeah. So then they're all sort of, then they're parallel.
As in- okay,
You could say,
It is.
as Medicare reimbursement
Something that
rates
slips
rise,
you out.
that
It
covers
does- it
the
isn't an
cost of
easy read.
delivering care. You could use a different term just to
yeah,
shake it out. So
So
if
take
you
it off.
delete increasing Medicaid funded.
Yeah.
And right after we, okay, delete it, and then.
If the rates,
Providers that's Medicaid reimbursement rates rise that cover.
No,
Or.
No.
it's meant to say Medicaid reimbursement rates. Medicaid reimbursement rate increases for safety net providers because increasing Medicaid reimbursement rates that cover.
You want it,
Because Medicaid reimbursement rates that cover the cost of delivering care.
that's sounding like a fact, not an ask. what this needs to correlate is, what is your ask? You want it to be increasing the reimbursements, right?
What is the
Right.
action here that we're asking for, that the rate?
Medicaid
Rates
reimbursement
increase.
increases for safety net providers.
That's
Sure,
what I
that's
said.
the ask, that's the
Yeah,
ask.
the ask, yeah.
And
okay.
then because increasing Medicaid reimbursement rates
So
to
maybe,
cover the cost of delivering care.
maybe it could be,
So it's just a matter of fact that you press, so it really should be a period after safety net providers, and you're saying because increasing
or the
Medicaid
continuous.
reimbursement rates cover the cost of. To me, that's just a fact that's supporting why we're asking for an increase.
Yeah.
Can you
So-
take out as,
Something about it compensating for the increasing Medicaid.
no, that's not why we're doing it. We're saying the rates are too low, so our dream is you'll reimburse 73% instead of
Yeah.
70%.
The first part of this is saying that we're asking for Medicaid reimbursement rates to be increased. Because, and we think the reason they should be increased is because that increase of
Okay,
those
so-
rates to meet the cost of care
Mhm.
Yeah,
is the
so-
best way to promote health.
Medicaid reimbursement rates be increased for safety net providers.
Yeah,
How's that?
yeah.
Be increased for safety net providers, because because increasing Medicaid reimbursement. Safety.
Increasing the rate of Medicaid reimbursement to cover, or increasing Medicaid reimbursement rates to cover instead of that.
That cover, yeah,
Just to cover.
cover. So Medicaid reimbursement rates be increased for safety net providers as increasing Medicaid reimbursement rates. That sounds very confusing.
Yeah.
Run-
I think it should be-
run-
Yeah, it's a run-on, it's, yeah. Be increased for safety net providers.
Semicolon, or you can't do a semicolon in the reso. Never mind.
Comma?
Yeah.
Maybe as a test,
Let's
scroll
see.
up a little
Increase
bit
for
further
safety
again,
net
so
How about we use the
providers.
word using?
we're
So we said
asking, therefore, it
Medicaid
should be
reimbursement rates be
resolved
increased for
that
safety net
community boards
providers
supports
using
fully
increased
request for New York
Medicaid.
Health
Yeah.
Medicaid reimbursements, right?
I think
Like,
the
I
only-
think you should read it like that.
What's,
It's being each of these. No, you keep scrolling, the full bucket that we're
Yeah,
asking is,
the be it
therefore it be
resolved
resolved
that-
that the community board six supports the following request for New York Health and Hospitals. Medicare reimbursement rate be increased for safety net providers, because increasing Medicaid reimbursement rates to cover the cost of delivering care is the best method to address disparities among hospitals.
Yeah, I like
Yeah,
that
I like
because,
that.
yeah.
So providers,
clearer.
after providers, it's because makes the app as. We all add it.
Yeah.
It's just
Because
temporary.
because increasing, yeah,
the Medicaid reimbursement rate be increased for safety net providers because increasing Medicaid reimbursement rates.
To cover the cost.
No, this is clear.
Delivering-
Yeah.
It's much clearer.
yeah.
I think somebody will have to read it all over again, just to make sure all of the English is consistent.
Yeah.
But
Yes.
it's
Yeah,
reading
Yeah.
better.
And then we can delete that last part. We'll prepare a letter that can be deleted.
But this is the letter.
Yeah, this is the letter, yeah.
Exoskeleton.
So can we please go back to that whole be it resolved?
yes.
Yeah.
So for the first one, do we say make permanent the fee for service upper payment level? I'm asking, I'm not.
Is all
saying.
that the fee?
No, I
Yeah,
guess it's all, sorry, I'm overthinking
Yeah,
it.
be made
Well, it's very
permanent.
defined
I see what you're saying.
Okay.
yeah,
Good.
yeah.
And the second one is also sort of parallel.
I kind of agree with him. Yeah, you want the first one to be written like the third one. The
Yeah.
ask is up.
Yeah, the ask is up front, yeah,
So it's made permanent.
yeah.
Only if.
An
only if
increase
you
was
all
made
Make
like it.
permanent, yeah.
So. So then you take out the
Service
be
units to be
made permanent.
After
Make
utilization.
permanent the fee for.
Oh, yeah, that's repetitive.
Yeah,
Yeah, I guess we wanted to double permanent.
yeah. Make permanent the fee for service upper payment limit, which provides an enhanced Medicaid reimbursement rates that reflect the actual costs. Yeah, I think that makes sense.
And then that would be.
And then we wanna do the same thing for this one,
I mean,
which name,
telehealth. care.
yeah.
Make permanent the telehealth care, vulnerable patients.
So put a comma after services,
Yes.
thank you. So do we then say increase Medicaid reimbursement rates for safety net providers?
Yeah.
We're starting everything with that.
Yeah, yeah,
No, make permit, no, sorry, increase, sorry.
yeah, increase Medicaid reimbursement rates, yeah. Yeah. Yeah, I think that looks
More active.
yeah,
Now, do we have whereases for each of the issues that we're now stating what we want?
No.
We should.
yeah.
Oh, God. All
Yeah,
we're saying is,
so for instance,
yeah.
you
I know
know,
what-
a Medicaid reimbursement rate does not reflect the actual cost of
We
services.
have that.
Yeah,
Okay, and then, you know, the telehealth parity law.
Is what we don't have.
That can be a
That-
whereas given the data,
yeah.
number
So,
of
so
health.
can we
Alright.
put a, can we put a whereas in and I'll phone in with. the
So how
numbers?
about this for now? Let's move on from this.
Yeah,
And then we can revisit this next month, once we have more whereases and kind of finalized.
Okay, so,
Because we will have to wait for the data anyway.
but here's his first, I'm sorry, go ahead.
and I was going to say, I was gonna interject by saying that it won't make any difference in terms of timing for CB6 because January's Health and Environment Committee meeting is before.
Oh, great.
Oh, okay,
Full board in January is on January 14th.
okay.
Health in January is on January 8th.
Oh, okay,
So-
so that's not gonna,
So it's not,
Yeah.
No
like,
difference.
if,
yeah,
you know, if the committee and the CAB goes back and, works on some whereas clauses that sort of reflect the resolve clauses.
Yeah.
It
So
won't make any difference.
yeah.
we'll get you
So then,
a whereas.
yeah,
Ryan and I'll work together for a whereas for telehealth parity. Thank you for that suggestion.
Yes.
So lobby day where we get on a blower and talk to the chief of staffs or the persons is the 10th, I think, which is why we're running.
February 10th, you said? Okay,
Yeah. But there is, is it the 11th?
One of the.
Sorry.
I don't know which day is which, but it's. a
But we'll
Wednesday.
tell you, but
Alright.
that's internal, but external is the legislative breakfast, and that is the last Friday of the month. And also it's on the calendar, and of course you're all invited.
yeah, all right. Okay. so-
We're asking Mark Levine to show up, he showed up before,
Mhm.
we'll say, come on, you know the map, just do it, this time you got a better job, so,
Yeah,
To Marty's point too, telehealth, yes.
yeah.
The last one you had was increasing Medicare reimbursements. If you could put another whereas, because I don't think it explicitly says it in the one that you have right now.
Oh, so can we, it's,
That's and that's a good protocol, is that you want that support
Yeah.
leading up to the request. I think Evan has a question.
hi, Kevin. So
Hi,
you should-
Karen, how are you? And everyone else. I know you had mentioned the mayor-elect, he has proposed increased blanket funding for health and hospitals. I just wanted to put that out there. He hasn't
Wow.
drilled down on the proposal, but he has already made that commitment.
okay,
Increased
Wow.
blanket funding.
all right.
But, so I have a question, you're saying we have to do something about Medicare reimbursement rates?
I would say, in echoing Marty, for the action items and your therefore we resolve, just make sure that it is.
Does that work where it says 60%? Might not work.
Reimbursements.
I'm not.
Here's what I'm saying.
I'm curious, I'm
Before
not,
we meet again, just
criticizing.
take a look at it again,
Yeah.
because we could do our own homework,
Yeah.
but
We
for the
could,
sake of, I think. our
we could also to
time
make it
today,
even clearer, we could just
Just-
say, whereas Medicaid only reimburses 70%.
Right, there you go, that,
And
and then,
60%
yeah.
of Bellevue's patients.
So he knows
Yeah.
exactly
Just
what
to
you mean.
refine it.
Yeah.
He knows exactly what you mean.
We want this to be one.
Yes, thank you. Oh,
Yeah.
perfect. I'm glad you figured it out. I would have said, what? It's right there. What's wrong?
All right,
Perfect.
so,
Thank you all very much.
Thank
Of
you.
course,
thank
all
you
the
for,
information.
yeah,
for
thank you
bringing
for the
it.
information and,
Yeah.
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 all right,
Thank you so much.
thank you.
Thank you.
Thank you.
Again, get it to you a week before the meeting.
Actually, if you could do it a little bit more than a week, because then we also need some time to
We
look at it and
have
everything.
We have a meeting, a CAB meeting on Wednesday, so I think we
Yeah,
can do it by
of course.
Thursday, because
Yeah.
we'll
Yeah, that,
in
Yeah,
person.
that would be great, yeah,
Okay.
So.
Nice Christmas present.
yeah.
So
Thank
look forward
you.
by the end of next week.
All right, that sounds perfect, thank you, thank you.
Happy holidays.
Happy holidays,
everyone.
Take care.
All right, moving on to the second item, discussion of proposal for the city, state, and federal governments to prohibit all non-essential helicopter flights over the New York City metropolitan area. Do we have that can you pull up that resolution?
Going to the resolve, but if anyone wants to look at whereas clauses, you can scroll to those.
All right. Um.
I
Can
like all
you,
the stats you came up with.
yeah, that was really helpful.
Very
That
impressed.
was very helpful, yeah. Um, Brendan, can you go up to the top, please?
Sure.
I had added a resolve because Sandy had mentioned something about making sure that the helicopter flights that are used for NYU for organ delivery system, that we specify that they're not gonna be affected by it. So I thought I had added it in there.
Make sure it's added.
It was the second whereas that I had added. So is it there?
we can
No,
sure it
it's
is.
not.
I mean, that's
Okay.
by definition an essential flight.
Yeah, that they will
We're
not
just
be
getting
affect,
rid of-
that basically what you wanted to specify was that they are gonna be unaffected by this resolution.
Yeah.
So I had something along the lines of, whereas helicopters used by a New York University for organ delivery system and other medical use is considered essential and therefore unaffected by this resolution.
Okay, I think I
So-
got it.
Yeah,
So whereas,
helicopters used by New York University for organ delivery system and other medical use is considered essential and therefore unaffected by this resolution. We can move this to the bottom if you want. I think that should move to the bottom.
It would flow. better.
Yeah, it will flow. As I'm looking at it, I'm like, this should probably go to the bottom. Yeah,
That's still worthy.
yeah. All right, any comments or anything, any questions, or do we want to vote?
Yeah, I think we discussed it extensively
Yeah,
last time.
I
and
think you
resolution's
just-
Really well written.
Yeah, I
So
think.
motion to call for vote.
All right, let's.
Second.
All right.
okay. Is there a second?
Yeah, Marty seconded
Okay,
it.
sorry, I didn't hear that.
That's
Okay, when I call your name, please say whether you're in favor, opposed, abstain, or not entitled. Marty Bear,
In favor.
Elvie Baroso,
in favor.
Liz Burr,
In favor.
Brock Friedman,
In favor.
Rupal Kakad,
In favor.
Kevin O'Keefe,
In favor.
Lubin Siddiqui,
In favor.
and Kat Valero.
In favor.
With all 8 committee members in favor, this resolution passes.
All right,
We've had so many discussions about helicopters and noise over the years. You know, there was, Lou Sapersky, I don't know how many here even know the name anymore. He was a member of the board for 50 years, chair, head of transportation, head of
That's
public
amazing.
safety, whatever. In fact, we have a resolution 2 years ago upon his death to name the extension of the walkway along from 53rd Street to 60th Street in his name, as it was his idea to actually have it. And he was after helicopters. You know, we managed to get convince Halliburton to close their helicopter pad on 60th Street and to greatly reduce the number of helicopters at 34th Street.
but hopefully we'll get less and less. We'll keep chipping away at him. So, Diane Park has her hand raised. So go ahead, Diane.
Yes, hello, thank you. Can you hear me?
Yes, we can.
Okay, great. I'm here basically on behalf of the 34,000 people at the Waterside Tenants Association and at Stuyvesant Town, Peter Cooper Village, regarding the very noisy, dangerous, and toxic seaplanes that fly up and down the East River. And is there any way, these planes are extremely problematic in our neighborhood. They're arguably more dangerous than helicopters as they take off and land on a small strip in the East River between two bridges, a very congested river with barges, ferries, party boats, and more. There are two schools located right next to the marina where the planes dock. I've spoken directly to one of the executives of these schools, and she told me that the excessive noise from the seaplane has a negative impact on instruction. The World Health Organization and the EPA both recommend that the outdoor decibels for schools should be no more than 55 dBAs. My apartment is roughly 350 feet above the ground at Waterside Plaza, and I got readings as high as 97 dBA, 350 feet away. But additionally, these seaplanes are taking off right next to our building, which is a violation of the New York City law. They fly dangerously close to the Con Edison power point. They're literally an accident waiting to happen. And we were hoping that any proposal regarding helicopters would include these very dangerous, noisy, and toxic seaplanes.
So Diane, the chair of the committee, Sandy McKee, has actually emailed me about that as well. So the Land Use and Waterfront Committee is actually looking at specifically the seaplanes and working on a resolution for seaplanes. And she has asked if the Health Committee would want to co-sponsor it. So we are in talks of having a separate resolution in conjunction with the Land Use and Waterfront Committee together. So it is in the works.
Okay, great. Yeah, thank you so much. And I would urge you to do that. I mean, I can, and also when I've been living at Waterside for almost 33 years now. And when I first moved here, there was the occasional seaplane, and now they are just during the summer season, when they, like, right after Labor Day, Memorial Day, and right through to really October, they are just inundating our community. And then in more recent years, there were these commuter seaplanes that were flying in with a company called Tailwind. That company has subsequently gone out of business, but they're trying to find another, partner. And also, as I know you probably are aware, the Economic Development Corporation has asked to expand the dock at the Skyport Marina to allow for more seaplanes to land.
Yeah, wow. All right, so yeah, we're I don't know when the next meeting is for Land Use and Waterfront, but I have it on my calendar that I'm gonna join on Zoom and kind of, work with them on that. Yeah.
Right, great. That would be so appreciated. And the other thing is, like, as you may or may not know, Waterside Community Plaza, it has a large senior citizen population, and all of the studies show that loud noise like this is very, has a negative impact on health as well.
Yeah. All right. Thank you, Diane.
Okay, thank you very much.
And Kevin has his hand up.
I just wanted to thank Diane for bringing this up. There was a crash there in 2017 that Diane might be aware of a seaplane right there at 23rd Street. And then you've got, obviously, that garage that's going to be rebuilt with that seaplane wharf access. And we really need to take a bigger look at that. I don't think it's necessary. And by the way, the crash that happened in 2017, it was a dad and his daughter flying to their place in the Hamptons. So again, private, yeah. We should circle back on this whenever we can. That's all.
So, moving along, chair's report, so. On November 17th, NYU Langone had an open house. Gloria, LV, Sandy, Jesus, attended the open house. I wasn't able to go, but Gloria was, able to write a summary of her experience there that she wanted me to share with the committee, so I'm just gonna read her short summary. There were multiple presentations covering an overall view of the care they provided and where, with expansion in Brooklyn and Long Island. There were many areas of medicine covered, including emergency department, cancer care, pediatric care, and population health. A few highlighted presentations were the overview of NYU Langone health payer mix, which was presented by Dr. Fritz Francois. Sorry if I didn't pronounce your name correctly. Executive Vice President and Vice Dean, Chief of Hospital Operations. The emergency care section was presented by Dr. Olumide Akunditer, Associate Chief of Ronald O. Perlman Department of Emergency Medicine. Our community service plan population health section was presented by Sue Kaplan, JD, research professor in the Department of Population Health and director of the Community Service Plan. CB6 attendees had a productive talk with Dr. Kaplan of Population Health. She explained how they researched community health status and issues for 2 districts and expressed wanting to work with us to do same for our district. In follow-up to that, CB6, we will be meeting with her on December 23rd to discuss moving forward on this much-needed research project. We actually have a Zoom call scheduled on that day around 12 or 12:30 or something that we're gonna have to discuss this. As a caveat, she explained that the data will be more macro than micro, meaning we won't have everything we may desire in terms of specificity, but will be important data to have. A summary was the NYU payer mix. Summary of the NYU payer mix was that with 44% Medicare, 26% Medicaid, and 29% commercial insurance. Medicare and Medicaid accounted for 70% of their patients. They had an opportunity to tour their state-of-the-art hospital rooms, which were all private rooms and through the most advanced technology, empower patients on their own through an iPad TV tech system, access their care records, reports, etc., food orders, watch programs and educational videos, manage temperature in their rooms, window shades up or down, and more. Also, what is available to caregivers from delivery of medicine to being able to conduct small surgical procedures right in the room. It was beyond impressive. The building we were in is all private rooms, and they were working to make all buildings private rooms. She attached 2 documents for the committee, which we'll send out later to everybody. And then one is NYU news site and providers in Manhattan, one of those documents, and the other one is PowerPoint shared at the presentation with a lot of excellent information. So yeah, we'll send that out later. So I've forwarded those documents to Jesus, so we'll send that out. All right, and then any questions or anything, or?
I would think it'd be great for her to present to us
Yeah,
as a committee, sounds very interesting. very
yeah,
interesting.
it sounded really interesting, so I can always ask if she's willing to talk about it more at next month's meeting. She's obviously unavailable for this month, but yeah. So yeah, we can ask her, see if she can talk more about it. All right, old or new business? Jesus, you're up.
Hello, everyone. Thank you, Rupal. All right, so at the most recent executive committee meeting, the committee, after having heard a presentation from the budget committee chair, is trying out something new in order to help the board update its district needs statement in a more efficient and comprehensive manner. For those of you who are new and don't know exactly what I'm talking about, every year the board works on a statement of district needs and budget requests. The budget request is probably more familiar to all of you because your committees at a certain time of year put them on the agenda and you go and discuss them, you add things, you remove things, you update things. But there's a second part to that process called the Statement of District Needs, where it's sort of more of a essay portion, narrative portion um, about the needs that are present in this particular district. And this is what it looks like. And this is the cover of it. It's an actual report, and it's, many, many, many pages long, or almost 50 pages long, this one. And it is put together by the Department of City Planning with information that we provide. We write the whole thing, they just put it into report form. And we put it on our website because elected officials use this, agencies use this, the public has access to this, so that they can really feel like they understand what the needs of Manhattan Community District 6 are. So it's an important piece of work, but for several years now, the narrative portion, the essay portion of this, the board hasn't really been updating it very much. And so we felt that by trying something new, it might get the committees more interested in talking about it, so that then when this new version is due in October, we will have something really good to put forward to the city. Now, one thing to note, this report is broken up into several sections, subject matter sections, and I'm increasing the font here in case that it's not visible.
It's just your screen is not being shared.
Not on the screen.
We're not seeing the screen.
I am so sorry, that's a rookie mistake there. Let's see.
Been a long day.
Here we go. Okay, then I'll just quickly go back to this is the cover of the report.
Oh, there we go.
There we go. Now we
Okay.
can see.
This is the cover of the report. Sorry about that. And as I was saying, the report is broken up into many different sections, but the most important are the subject matter sections. Health care and human services, which obviously is the purview of this committee. Youth and education and child welfare, that's another committee. Public safety and emergency services, that's yet another committee. Core infrastructure, city services, and resiliency. Now, there are some environmental elements in that, and the other part of your committee's name is environment. So you will actually be looking a little bit at that section as well, and so on and so forth. So the way the report is broken up is not exactly the way our committees are broken up, but that's going to be the case for every board. So some committees may have 2, maybe even 3 sections to look at. So we figured what would be easiest for the committees is if we took these sections and put them into resolution form, something that you're more used to seeing. So that's what we've done. We've taken these sections, taken all the text and put it into a resolution form. The first part of each section is for whatever subject matter section that is. In this case, let's say healthcare and human services. You are given a long list of needs, of issues that you have to pick the most important one for that subject matter section in the district. So, for example, out of all of these, anything from access to healthy food, to mental health, to domestic violence services for victims, you as a committee would have to agree on which one of these is the most important. And that's not always easy because all of these seem important, but you have to pick one. The most recent pick that the board has made is in this section is services to reduce or prevent homelessness. So it could be that the committee will look at all of these and say, you know what we've picked already is still the most important need for the upcoming fiscal year, or you guys can talk about it, about changing it, but you all have to agree as a committee which one it will be. So we list them all out here in the resolution, so you have them in front of you. And once you've picked the one you think is the most important, then in the report, you have to write a a narrative, you know, a little mini expository section where you talk about it. And this is what is currently in the report for this particular need, reducing and preventing homelessness. You can adapt this, you can change it, you can leave it as it is. It's always good to look at it and make sure there isn't any data in there that has a shelf life in case, because there are some sections that the board has been submitting that are outdated. If they were really outdated, the office just didn't submit them because we didn't want to submit stale information to the city and have people be looking at that. But we put this for you here so you have easy access to it. If there are any sources that you want to cite, we have a section for that here, and you can always add more as you need. And then in this section, you also have subsections where you can talk about more specific needs in this broader category. For health and human services, the subsections are needs for healthcare facilities, healthcare and facilities, so hospitals and clinics specifically, needs for older New Yorkers, needs for homeless New Yorkers, and needs for low-income New Yorkers. And so these sections are optional. You don't have to submit specific information for these. But if you have information to share about needs that these particular subsections have, you can put that information here. We did submit information for needs for healthcare and facilities. And we did not submit for others, the needs for older New Yorkers, because the information that the board had was outdated. And so maybe you guys can take a look at that and decide to update it or decide just to not to submit anything next year as well. Needs for homeless New Yorkers, it had not been updated in a while, so it wasn't submitted. And needs for low-income New Yorkers, it also had not been updated in a while, so we didn't submit it. But once you have made all your choices about what's the most important issue in this subject matter area, and then it's a blurb about it, and then if you have anything to say about those subsections, you can put the actual final text here. Then your board, your committee can pass it, and then we can, as all the other committees are also passing resolutions on their subject matter areas, we can put it all together into the report. And so then when you vote on it in October, like you vote on the budget requests, you'll also vote on this report section so that everything will have been viewed by the board and everything will be a product of the board. And so hopefully it'll be a better report because of it. There are also resources that the city provides that might be relevant to the particular subject matter area you have right here. Some of them are good, or some of them are better than others. And so, but we're just giving you what the city provides. You can certainly use other ones if you find that they are better. But I'll stop there and see if anyone has any questions. Or is this pretty was that pretty clear?
No, Liz has a question.
Yeah, I have a question. I think you mentioned that for environment, we might have to work on that one with
Yes,
another.
I can show it to you really quickly. This is the resolution for the core infrastructure, city services, and resiliency section. The city made that section, we did not, but there are environmental elements within that. Obviously, this committee does not concern itself with core infrastructure. It doesn't really concern itself with city services. The city services that they're thinking about are like trash collection and stuff like that. But as you can see, some of the issues that you can pick as your most important issue in this particular section, some of them are noise pollution, which this committee has discussed in various, like I believe, ambulance sirens and things like that. You're talking about helicopter noise, so that's something. Water issues, water supply issues, water pollution. So we're still working out, since at least 3 committees may have claim to this particular reso, how we're going to figure out which is the most, who gets to decide which is the most important one. But yes, we'll be sending you this either tonight or tomorrow, so that you guys can start having a look at it. What I suggest you do is, as a little homework assignment, to just for right now, focus on selecting the most important issue. So this sort of bulleted part of each of the resos. We have several months to work on this. We don't have to do it all in one big go. So for these, and we can even start with just the healthcare one. But for just the healthcare one, of all of these selections, and there is an other section in case you think that there's something that is health and human services related that is not already listed here, but that you think rises to the level of most important concern in this section, in this district. You can write something in, but by January 5th, so you have this week, you have Christmas week, and then a few days after that, select which one you think is the most important healthcare and human services concern for Manhattan Community District 6. And then on top of that, explain a little bit why. Maybe it's because I've seen in this community XYZ, and that leads me to believe that this is the most important health and human services issue in this district. So it's, entirely anecdotal. Maybe you saw a report that indicates that, this other thing is the most important issue in this district for this subject matter. Maybe you have some other evidence, but pick one and then sort of answer the question, why do you think that's the most important? What we're not going to do is sort of draft this thing by committee, but we want your ideas, we want your feedback, and then we'll take notes, and then we'll take those notes and the office will draft something that is faithful to what the committee thinks. I think that'll probably be the most efficient way to do it.
We used to have the chairs do it.
Yes, but that's a lot of responsibility on them. And, it's a product of the board. So the entire board should have input in this. So this is a more democratic, small d democratic way of doing it. So does that sound doable, that by January 5th, everyone will email, Brendan will be the one sending these out to you. And for right now, we'll work on just the health one, but he'll send you both. But can everyone by January 5th send Brendan and me your pick for the most important health and human services issue, plus why you think that's the case. And then we'll compile them into one email. Brendan will send it out to all of you. And then later that week, you'll have your January health meeting, and you guys can talk about them. You can say, let's see how many different number ones come up, and let's see, you guys can then talk. You don't have to necessarily decide in January. You can take some time to discuss, but that's going to be a good way to get the discussion going, and we'll go from there.
A couple more questions, Jesus.
Huh?
A couple more questions from us.
Sure.
Go ahead, Mubin.
Jesus, this may be quite obvious, but I'm just a little confused. So all of the statement of needs by all of the committees are being converted into a resolution format.
So right now, all of those sections that you saw, we're breaking them apart and making them their own section, their own resolutions. And then the committees are going to work with those resolutions because they're used to working with resolutions. Now, what that means is at the end of this process, we're going to have like 8 different resolutions floating.
Right.
We are we're still kind of playing that by ear. What I think will happen ultimately is then we will condense all of those resolutions into sort of the draft of the report. Rather than having 8 separate resolutions floating about, we might just condense it into one, just like we do with the budget requests. They're all condensed into one. It probably get condensed into that very one. So then that way, It really is just one resolution that has the draft of the report, the whole report, plus the budget requests. And that way, it might be easier for folks that way. But the resolutions, they're merely just sort of like
A tool.
a
Yeah.
I don't know,
tool,
the
a tool,
reason-
yes, a tool to help focus your attention on just what needs to be looked at this moment.
No, I get that. The reason I ask is maybe I'm mixing apples and oranges, but I know when we were first talking about the statement of needs in general, both in this committee and others, one of the things that I found invaluable was you were saying, let's not remove anything. It's always easy to remove things. Have as long of a laundry list as need be.
Well, it's.
I don't recall that me ever saying that. That is not my philosophy.
Not you, I'm talking about
I said
Marty.
it.
Yeah.
Yeah,
I-
I'm
I-
more of
It-
a
it
less
makes
is
sense,
more.
But I found that compelling, and I'm just wondering if by condensing it, are we losing anything?
Well, it looks like we're now going to look at just one item, whereas
For
in the
committee.
past, we would list we would have several paragraphs in regards to several different issues
Mhm.
that were compelling
Pressing.
for the particular committee or our committee.
The condensing that I'm talking about is not to throw anything away. It's just to sort of, rather than having 8 different resos, to have one big reso.
Got
But
it.
the condensing, nothing will be lost unless you guys decide to edit or shorten something. But by that point, everything that you guys have passed will then go into the main resolution.
Understood, thank you.
Go ahead,
Anything
Karen.
else?
Yes.
I appreciate you giving us the opportunity to have input in this process. That's really appreciative. One of the things, I'm just curious on a practicum and logistics perspective. This charter, how often is it updated? I might have missed that. Is it an annual basis? The timeline that you gave us is October, so that's around the same time that we were talking about budgeting, and I think that's where we got. some
It should be
information.
annual. It should be
Yes.
annual, but it isn't, like you see, in the current version, there's a big piece on COVID-19. So we probably won't need much on COVID-19, if anything.
Mhm.
You know, and if you look at the document, there's a lot of things that, well, in 2023, we will be doing such and such. And because that was written in 2021. And so there's a lot of things that need to come out.
Okay.
This
I'm
is a
seeing-
yearly report. This is a yearly report. And as far as the budget process as it concerns community boards is concerned, you can think of October 31st as our as October 31st as the important date. That's when everything is due. And then November 1st is sort of our New Year's, because that's when the new budget process starts for community boards. So it's always due on October 31st. Now, that said, that's when we have to submit it to the Department of City Planning. Obviously, you guys need to vote it first. So you're not going to be voting it on the very last day of October. You're going to be voting on it like the second Wednesday of that month. So it actually has to be done even sooner than October 31st. So we're starting it now because we want to not be rushing at the very end. And there are boards that are very late with this process, and that slows the agencies down so that they don't get, and then that means that the responses from the agencies get delayed. And so if we can stay on time with this, it really helps all the agencies that are going to be involved.
Well, to that end, I appreciate that. Just throwing this out there, in perpetuity with what we're trying to achieve here as a democratic process, I appreciate that. Has the office considered doing more evergreen kind of context in the sections that you kind of went through and said, well, we can focus on those later. We're just looking at which line item is important to us right now before January 5th, but on a larger scale with all the contents that's in this report, has the office talked about using more evergreen language to that end about all the different segments, COVID-19, noise pollution, just to kind of.
I think there is some opportunity for use of evergreen. There is some opportunity for use of evergreen language in some of the sections. There is actually a section that is not particular to one subject matter, but is sort of like okay, for the whole district, among all of these subjects, what are the top 3 issues of anything? And in that, there is a lot of opportunity for evergreen language. We sort of describe we describe what the district looks like. We describe what's in it. We describe who lives there. We could describe a little bit of the history. There's a lot of room for us to sort of mold that into a way that we want to see it, and with information that will not change very much. Like, for example, the fact that Mount Sinai Beth Israel closed earlier this year, that's never going to change. That's always going to be, it's always going to have closed, this year. So there is some opportunity for evergreen information. But when it comes to, for example, use of stats and population metrics and population statistics and things like that, those obviously will change. So conditions on the ground can change. So I imagine this district looks very different now than it did 20 years ago, even 10 years ago. So some things will change. Anything else?
Any other questions?
The demographics part, the 2020 census that breaks down, that's really interesting information.
Hmm.
I will always suggest everybody to look at that section.
Is this found on our website?
Yes, it is. In fact, this report that I showed you, it was on, if you go to our website and under the committees section, go to the budget committees page, where I am now. At the very bottom, you will see, actually, no, it's right here, a link to the annual district needs statement. Depending on when you look at it, I think we're going to be getting the new one in another month or so, maybe 2. Once we get it, then we will update that. And but yes, we always have it there for people to look at. And there are some parts where it's a little rough, but that's why we're doing this, because this past year, we put together one big Google Doc with all of the drafts for all of the sections and just had everyone sort of on the honor code promise to go look at it and update it. Very few people did. And then those that did, there were updates all over the place and it wasn't very orderly. And so that wasn't the best way to do it. So we're not going to do that anymore. We're going to try something else and see if this works better.
Thank
So-
you.
Thank you, Jesus.
No problem. So hopefully, everyone can, but excuse me, on January 5th as the deadline, preferably sooner than that. You pick which one is your top issue and then you tell why, so that if everyone does it on time, we can then send them all to everybody. You can all read over them and hopefully have a very interesting and robust discussion at your January meeting.
All
Which
right.
is after the deadline, right? This is on the 8th, December, January.
No, this is the
No,
next
this is
year.
this
This
is
is
for
for
next
next
year. Yeah. All right. Any other old or new business?
Old business, we've talked many, many times over the course of these meetings about the health fairs. That, are we putting it to bed or?
No, Karen, I'm waiting on Karen to get back to me about something.
Okay.
Yeah. She actually mentioned it to me before the meeting started. So, yeah,
Us.
I'm waiting on her to email me with some information. Yeah.
Excellent.
Anything else? All right, seeing no other business, can I get a motion to adjourn?
Motion to adjourn.
Meeting adjourned at 8:04 PM.
That's a record.
Yay.